Hello, I am Andrea, one of your case managers here at Ariel. I have been tasked to present your training for this month. I'm excited to talk about how to take care of yourself and help prevent or repair burnout. According to the National Foster Youth Institute, the turnover rate of foster parents ranges from 30 to 50%. This means that of the families who open their home to foster care, 30 to 50% decide to end their foster care journey. I believe this is within the first year. This low retention rate is due to several factors. One is lack of training. Of course, this is one that we at Ariel try to address as we encourage you to complete the training we offer. Another is support, which is also an area that Ariel focuses on with our aim to be different than other agencies by offering more support. The factor that we'll be focusing on today is burnout. Burnout in foster care can occur when you become overwhelmed and feel inadequate or unable to care for children placed in your home. The Justice Resource Institute lists these symptoms of burnout: disruptive sleep, which can be the inability to fall asleep or to stay asleep; intrusive thoughts about a child's trauma or one's own trauma. The trauma that a child has experienced can be hard to emotionally handle for any caregiver. Often the child's experiences trigger trauma from your own past. Anxiety, which is often seen as a feeling of fear, dread, or uneasiness. Forgetfulness, which can also be an effect from disrupted sleep. Difficulty forming sentences and thinking of words. This happens to me when I feel too much stress. Feeling overwhelmed by things not typically overwhelming, which goes along with reacting intensely to things that are not intense. I have seen this many times in myself and others when there seems to be too many demands that I feel I cannot meet. Shortness of temper, which can cause more stress within your home or be a trauma trigger for children. Crying or extreme sadness or feelings of depression. Isolating oneself from supports, possibly because you don't want them to think you are failing. Physical health problems. I wholeheartedly believe that all of the above can be manifested physically. This can include headaches, stomach or digestive issues, muscle aches, chest pain, and frequent illnesses, among other issues. Please remember, this is not an exhaustive list. Your symptoms may look entirely different, but that does not mean you are not experiencing the physical or emotional exhaustion that accompanies burnout. So what triggers burnout? Here are just a few examples. Right after the first placement arrives, when there's a lot of adjusting going on for everyone. When a child is struggling, as it's hard not to struggle with them and to not take difficult behaviors personally. When a child is reunifying or being adopted as pre-grieving a loss is a thing. After a child reunifies or moves to an adoptive home, and there again you can be grieving. When a child shares a trauma that was previously unknown, because this is painful to hear and could be a trigger to your own trauma. When a new placement arrives and a parent is still grieving their last placement. When there is a significant event going on within your family, such as loss of a parent, illness, loss of a pet, loss of a job, older children moving out, etc. Then if a placement ends suddenly, for whatever reason. There is no shame in experiencing burnout. You are not a failure. You can do this. You are human, you are imperfect, and you are raising an imperfect child. There will be hard times, really, really hard times, but you are not a failure. So we will now go over some ideas to help you move through the burnout and take care of you. Start with gathering your village. You have natural supports in your life, including family members, friends, neighbors, people at church, etc. Include all these people in your journey. Let them get excited or grieve with you. Accept any encouraging words or offers to help. If your sister offers to bring you a coffee, take her up on it. If your friend offers to watch the kids while you take a shower, say yes. Another way to gather your village is to find, especially where people understand what you're going through because they have been through it themselves. Many support groups can be found on social media through a search. You can also look on the co4kids.org website for additional training and support. One of the best ways to find support is through our own Ariel family. It has been difficult the last few years to meet in person. We all know why. Now that events have started back up, be sure to go. I recently had a foster mom attend the picnic in Grand Junction. She was hesitant to go due to a number of factors, including taking the time for it. However, after going, she told me how glad she was that she went. She was able to connect with other foster families as well as other people at Ariel. Your village can help with so many things. So learn and understand what triggers you and develop coping strategies. There are likely things in your past that caused some kind of trauma. This could be something you experienced in your own life, or it could be something you witnessed. Past experiences that caused emotional pain can come up when caring for a child in foster care. These triggers can include sounds, people, thoughts, smells, places, media, feelings, and situations. Things the child went through can remind you of what you experienced. Consider finding and maintaining a relationship with a therapist. The therapist can help you recognize what your triggers are and guide you through coping strategies. The best time to do this is before you take your first placement, but you are likely already on the journey, and it is never too late to seek help. Please understand that therapy does not mean you are weak, but rather it is acknowledging that you have a need and are willing to do what it takes to heal. Next is take time for yourself. What do you like to do that revitalizes you? Do you enjoy hiking, reading a book, or playing mindless games on your phone? Whatever helps you to recharge, be sure to make time to do it, daily if possible. Don't just think that you will do it one day or eventually, but actually schedule time to do it. This is an opportunity to get help from your village. Arrange to have someone care for the kids so you can take care of you. This really is a big one that can make a huge difference. For myself, I need some quiet time, preferably in nature. Just taking a bit of time to sit and decompress makes a major difference for me. Next is lean on your case manager. That is what your case manager is there for. We don't just make sure you turn in your paperwork or only visit to check a box. We are there for you. If you are frustrated about something happening in the case for the child in your care, talk to your case manager. If you need a sounding board to help with a behavior we're dealing with, we can help. Even if you simply need a shoulder to cry on, call your case manager. On the flip side, we can also celebrate the little victories with you, such as a child staying dry through the night. Your case manager is the Ariel difference. So I won't try to be Aretha Franklin, but I can hear her singing RESPITE. Find out what it means to you. I know, that's kind of cheesy. But respite is for more than just a place to send a child in your care when you're not able to take them with you. If you need a weekend or even a couple hours to take time for yourself, ask for respite. There are a lot of other foster parents that understand what you are going through and can give that help. You might find a family that also needs respite at times so you can trade. Here's another example of using your case manager. Let them help you find respite. so you know whoever takes care of your child is trustworthy and safe. Having a weekend of respite can be the time you need to recharge so you can keep going with caring for your child. Take a break. We know there are times when a child in your care leaves for some reason. The goal is always reunification, so you can expect this to happen at some point. It is completely acceptable and somewhat expected for you to take a break when a child leaves your home. It is up to you how long of a break you take. It could be just a few weeks so you can recharge, or it could be several months. However long it takes, a break from having a child placed in your home can help make sure you are truly ready for the next placement. Then last of all, have compassion for yourself. When you become emotionally exhausted, it can be easy to discredit yourself and believe you are not good enough. Don't listen to that little voice in your head that reminds you of your flaws and shortcomings. You are what a child needs. You are doing better than you think. The children in foster care are difficult and come with a lot of baggage. Just because they are acting up or being disobedient does not mean there is something wrong with you. Don't take their behaviors personally. Remember that you have gone through an extensive process to become licensed for foster care. You are worthy and capable. In the end, it is all about taking care of yourself because you cannot effectively take care of a child if your own needs are not being met. Recognizing that you are getting to the point of burnout and admitting it to yourself and others is the first step. You can have your pity party, but do not let yourself stay there. Get up, get moving, and take care of yourself.